Hello, everyone. It's Wednesday, August the 12th. And on the way in here today, I was just thinking about, the fact that it's August the 12th. And I can remember, just like it was yesterday, how long it seemed like May was. Because it was almost like we could never get to the end of May. We had our kids out of school, and we had this thing that we didn't know anything about, and it was jumping all over us, and we really, May seemed incredibly long. And then June came along, and there was probably an uptick, of additional hope. And then, toward the end of July, or the latter weeks of July, we saw our nation with an uptick on the bad side in a very significant way. I guess it probably started with Arizona, Texas, and Florida, and now it's completely wild as it can be and out of control, maybe in Mississippi and Alabama, especially Kentucky, which is our neighbor. And so we've seen this thing, kind of ebb and flow just a little bit. But I can think back to May, and I can think, as a lot of West Virginians thought, me included, that possibly, just possibly, if we could get control of this, this thing would go away, and we would be able to at least start back to some level of normalcy, with the waiting of the vaccine. Well, we have got to continue to seek as much normalcy as we can. But at the same time, we've got to be smart, and we've got to know that this virus is with us, and it kills. And when it kills, it really hurts. And it hurts, families and loved ones, as well as losing great West Virginians. So from all of that, we've probably done some things that we shouldn't have done from the standpoint of people have traveled as they do on typical summer vacations. They've probably gone into areas that were infested with people, people standing upon top of people with no mask or whatever it may be. And all of a sudden, we've brought this killer back to West Virginia, as many other states have done within their states. So it continues to kill. I continue to urge for mask and safety and, pew in between and, and hygiene and social distancing and everything we can possibly do. Today, very regretfully, we have 12 more deaths. They're all elderly people. We've lost a 72-year-old female in Logan County, a 71-year-old female in Wyoming County, an 89-year-old female in Mercer County, an 82-year-old female in Mercer County, an 89-year-old female in Grant County, an 83-year-old female in Grant County, an 85-year-old male in Mercer County, an 82-year-old female in Grant County. The 150th death in West Virginia is an 81-year-old female in Mercer County. The 151st is a 79-year-old female in Mercer County. The 152nd is an 80-year-old male in Logan County. And the 153rd is a 42-year-old. Everyone here except this person, a 42-year-old male in Logan County. Everyone else is who this virus and this killer targets first and foremost. And that's our elderly. Now, before I get into the numbers, I want to do just this. And yes, this is tremendously difficult to do. We closed our nursing homes to visitation. I have absolutely been in contact with everyone that I can talk to about our nursing homes. Today, effective midnight tonight, we're going to have to close visitation to all the nursing homes in West Virginia again. We have got to some way try with all in us to calm this down. We have 28 nursing homes in West Virginia with active outbreaks right now. And there's no question that this is the issue across our nation, not just in West Virginia. Across our nation, we have nursing home deaths that account for an incredible amount of the 160,000 plus deaths across our nation. We have got to keep this out of our nursing homes. Some way, somehow, from the standpoint of us bringing it in visitation, or our staff, more than likely, our staff bringing it in. Asymptomatic, don't have any idea that you've gotten it, and you bring it in, and then it goes like wildfire right straight through the nursing home. And we read death after death after death after death. So we've got to do something. So we close visitation again. Now I want to say this to all the families. You know, if my mom or my dad were in the nursing home today, well, to just tell it straight up like it is, it would be a situation that I would feel just, disarmed. I wouldn't know what to do. You know, I know how much you love your parents and your grandparents, and I know how much I just lost my mic. Just 1 second. Y'all hold tight just a second. I surely know how much your mom or dad mean to you, and how much it means to your mom or your dad or your granddad or your grandmom to see you, to be able to see their children, to be able to see maybe their lifelong friend. I know how much it means. And I know it is absolutely just plain horrible for us to not be able to have visitation. And I know this. I know our nursing homes have done an amazing job with how to coordinate visitation. It's really, really, really sad. I want to tell you, though, as family members, and I want to tell your moms and your dads and your granddads and your grandmoms just this. We're going to work like crazy to come up with some way that we can measure, situations to where we have nursing homes in counties, and we can have some metric that we can go by to where we don't have to statewide close everything. We've got to have some level of participation that we have a metric. And so I will promise you with all in me that we will work as diligently as we can to have that out very, very, very quickly. Not something that's going to be out in a month, something that's going to be out in days, to where we'll be able to have visitation at certain nursing homes and not visitation at others. Now, it's going to have to all be based on county and based on the medical community and based on our experts all over the place. We'll come up with something, because I know how important it is for you to visit. And but at the same time, we cannot possibly come in every other day and lose 12 people or 17 people in West Virginia because, of something that maybe we can slow it down. Maybe we can cut it off at the pass and everything, and that's what I'm trying to do. From the standpoint of our numbers continue from the standpoint of how we reflect with the nation. Our numbers are not bad. We had 130 positive cases, which is not great, but not off the chart bad. Our positivity rating was 2.85, It's not as good as what we want, but remember, we were trying to shoot to get below 3 on a cumulative positivity rating. We have gone from 123 patients that are hospitalized to 135. Our active cases are now at 1,895, which is down from Friday, which was 1,914. Our RT number, get this now, our RT number, which Dr. Marsh talks about all the time, is now at 0.89. If you get it below 1, and we're at 0.89, which is significantly below 1, we are now the 5th best state in the nation with our RT number. Our numbers are not bad. Our nursing home situation is bad. That's why we've got to do something with our nursing homes today. I want to talk to you just a second about schools and our reopening plans, and I'm awaiting right now, all kinds of information coming from the Department of Ed. I expect that all that information to flow back to me by the end of the week. It is a culmination of a lot of information that's going to give us guidance on how we're going to be able to, under local control, we're going to be able to reopen our schools, and we're going to be able to be flexible and fluid and close our schools when we have to. I've told you so many times, I want to see our kids back in school, but there's no way on this earth that I want to see our kids back in school, our teachers there, our service personnel, whomever it may be, at high risk and everything. But we all know that we're not in any way going to be able to remove total risk all the time from everyone. It's not going to be done. It's just plain not going to be done until we get that vaccine. So, and really, we speculate on that the vaccine is coming, and it's coming quickly, meaning it's going to be here before the end of the year. What if it's not? What if it's not? And we've got to just continue to manage. When this thing first broke out, our leaders from the federal government, no one would have believed that this would have been going on for 3 weeks. And now it's going on upon month after month after month. And so we've got to learn to continue to live with it and continue to deal with it as best we possibly can, as safe as we possibly can in managing that risk. I remind everybody just this. I have powers to shut down our state in an emergency situation from the standpoint of schools or whatever it may be. But what we're trying to do here is completely what should be done. Local control should rule, and that's what we're going to do. The local input is going to rule the day. And as we go back to school from a standpoint of that input from the medical community or Department of Ed or whatever like that, we're going to come up with a metric that we can measure and go forward. And so we're still full steam ahead to go forward, but everybody around, while they're full steam ahead, everybody around is looking and watching and worried and able to pivot and able to be fluid in what we decide and do. So that's pretty much my report, from the standpoint of the locals and the school situation. From the standpoint of the bar situation in Monongalia County, we are now, and I'm going to have to jump forward here just 1 second, but we are extending that closure for 7 days. And during that 7-day period, we're accumulating protocol. Excuse me. We're accumulating protocol, from the bar owners, landlords, of course, naturally the medical community, restaurant owners, and everything. I was trying to just make sure that I had everyone in that I was talking about there. But we're accumulating how we can reopen our bars in Monongalia County. The numbers are better there. They have done much better, and that's good. Now, if we can come up with a protocol that truly works from the standpoint of going ahead and reopening and having those businesses function and everything else, we'll do so. Right now, we have been recommended from WVU to keep the bars closed for at least another 7 days. We're going to keep the bars closed for 7 more days and see where we stand. We're going to evaluate the protocol. Now, a disappointing thing is just this. When we called upon the Mon County Commission in the beginning, they gave us direction, all closed or whatever and everything, and now they're kind of diving in a ditch and saying, well, we really don't have any input. We don't want to weigh in on this. We don't have any input. Well, to be perfectly honest, that's their county, and they should surely to goodness have an input. But nevertheless, we're going to go with exactly just this. We're going to go with the fact that WVU is recommended to hold back. I still believe that absolutely we should hold back. We're listening to the medical community and everything else, and they're saying it's really not, there are those in the medical community that say we're really not accomplishing a lot, because when these kids come back, they're going to congregate together, whether it be in a bar or not in a bar, and we got to watch that and address all that. So really we're trying to be sympathetic to our business community up there and in what they're doing, but we're also trying in every way we can to protect the community. And that's why we reach out to county commissions and everything to have input. And when they say, well, we don't have a dog in that fight, well, they do. They just plain do. But nevertheless, we'll make the decisions. If they're not going to help make the decision, we're going to make the decision and keep going. Now, from the standpoint of corrections, I want to read to you, and Betsy Jibbinen is on the call today to answer any questions you may have or whatever. But, now we have 26 active inmate cases and 1 staff positive in the Southern Central Regional Jail. This facility is on a complete lockdown to eliminate movement within the jail. This is another example of how our correctionals people, or whatever it may be, our National Guard, DHHR, the local health officials or whatever, run to the fire. We run to the fire. That's what we're going to do all the time. Run to the fire when there's a problem and proactively try to get it under control as best we can. I want to thank the Division of Corrections, the DHHR, all those that are involved. They're doing good work here, and Betsy Jibbinen is on top of this and everything. We are beginning to retest all the inmates in the South Central Regional Jail today. There's a new program. It's called Help 304. Today, I am happy to announce a new service to help West Virginians deal with this terrible killer, this COVID-19 related stress or virus and all related stress. That program is called Help 304. It's right there on your screen. This is a hotline for those that are really struggling emotionally with this. And we want you to call, and someone will answer and will address your concerns, and we'll direct you to counselors or whatever it may be to be able to help you. Because we just know how difficult this is for lots and lots and lots of people. The initial focus of this is the most vulnerable communities and healthcare workers, first responders, and protective service workers. Again, if you're stressed in any way and you need someone, pick up the phone and call 1-877-HELP-304. Or just go on, your website or whatever, or our website, and pick that up at www.help and go with it. But nevertheless, if you're out there and you're struggling, reach out for help. It's always the thing to do. Yesterday, I had a real opportunity and everything to to move forward with 16 new Ford F-150 trucks that are going to be utilized to deliver hot and cold food storage systems and everything to our seniors. Now, it was really special to me, and the reason it was really special is because we've been working on it for a while. We didn't have, there was, we couldn't go with it to move all the vehicles out everywhere and everything until we had the titles right and all that. Well, we got them right yesterday morning. So we took off down there and everything, and lo and behold, we were able to go and do it. And I want to thank every one of those that was involved. Our Commissioner Roswell was there, and he did a great job and everything. I also want to thank all of our local directors of county, senior, and community services. Now, they weren't able to be there. We had to do this really quickly because we've been pushing to try to get this paperwork all done. And then, boom, it was done. And so as soon as it was done, we had to go. But we didn't have any way of anticipating when that date was. Now, we've got another one coming up here in not long where we're going to go out with another 20-plus vehicles and everything. And I hope at that point in time, we can bring a lot of people together and have another celebration of what we're able to do for the seniors. Now, let me just say this just for 1 second. Just think of what our seniors are going through today. They're scared to death because they hear me every day report on all these people that have died that are elderly. They're sitting at home, maybe by themselves. And really and truly, to be able today, especially today, to be able to see a friendly smile or hear a warming voice and be able to have a meal delivered to them, I mean, what do you think that really means to them? It means everything. And so if we go back to the last session and everything, when we dedicated and set aside some monies and everything to do some extra monies to do just this, because the very, very thing that we don't want in West Virginia is our people to be going hungry, and especially our seniors from the standpoint of, I don't know if I can say especially because our kids and everything, it's so important. It is just so important. But being able to just have that interaction and everything with someone that they know is out there and people that are really caring and everything. Yesterday was a terrific day. And so, now there's boots on the ground, making sure that our seniors are taken care of, and we're going to keep on doing this, and we're just going to work it just as hard as we possibly can. So to me, that was a real highlight of yesterday, that's for sure. Now, I've got some things I'm going to go through pretty quickly. We've got free testing that's going on in Brooke and Lewis counties this week, and next week we'll be in Lincoln County from our summer feeding program and everything. Again, no West Virginia needs to go hungry. We got all these sites set up, 696. If you have an issue and you can't figure it out on where to go or what you need to do, call us. Call 211, and we'll get you where you need to go. Our Kids Connect program, I want to very proudly announce that we have pledged the $6 million to establish 1,000 points of light, basically free wireless internet access across our state. We are moving today. I can tell you that we have started pre-installation work at sites where new equipment is needed, and we're on schedule for all the sites to be up and going by September the 8th. It's a daunting task. We may not make it exactly on September the 8th, but I'll be dogged if we're not trying. And we're trying really, really hard. And I really believe that it will enable our students where we have to go virtual or they choose to go virtual, and everything. It'll involve our parents having the choice on what to do, and their kids still, receive an education, and we've got to continue the education process. And I really believe that our teaching community is behind our effort and everything. We're trying to work with our teaching community from the standpoint of, if someone has an illness or an elderly person, I'm sure that the Department of Ed is working with them to maybe move them over into a virtual role and And so there's all kinds of stuff that's going on behind the scenes. Lots and lots of people doing a lot of great work, but the update on the Kids Connect program is good. From the standpoint of census, again, you got to get counted, West Virginia. From the standpoint of our churches, we have 3 outbreaks, active outbreaks now in Cabell, Wood, and Taylor County. The total number of active cases these outbreaks now account for 38 cases. That's significantly down. You're doing better in our churches, West Virginia. You're doing better. Keep wearing the mask. Keep that pew in between you. Social distance. Absolutely, from the standpoint of the elderly and everything, if you can get church online or whatever like that, may be the right choice today and everything, but we're doing better there. From the standpoint of our small business program, grant program, the $5,000 going out to our small businesses, all that's working great, moving in the right direction there. From the standpoint of our grants to our cities and our counties, we're significantly above $75 million to 169 cities and counties across the state. All's going really good there. Let me see. I think that's all I've got. I'm going to make sure. It is, except I want to just show you real quickly our numbers. And if you'll pull the graphs up, Jordan. If you'll look, we had a little blip right there just a few days ago. We were looking like we were going to widen up on the top, and now we've ticked down just a little bit. We got to get that thing moving more and more, apart. You see down on the next one, that's our daily positive chart right there. We keep ticking, tick, right slightly above that line. We want to dip, if we can, back down below the line, like we were in the latter part of June and early July. If you'll look back and everything, that was better. But we're sure a heck of a lot better than we were right toward the last stage of July or the first days of August, because now we're at 2.85 today, which is not as good as we've been. But in the early days of August there, we were at 5.41. And, but we got to do better. We got to do better, and we're going to do better. Our cumulative thing is at 2.39. The only thing I could say about this is states across this nation would give anything to have these numbers. But I would just say this about my opening comments. When we're content in West Virginia on losing 153 great West Virginians, then we got a problem. That's all there is to it in my book. We've lost 153 great people. And if we can prevent the 154th one with all in us, we should try with all in us to do just that. There's no question, West Virginia, you have been the miracle. You have done unbelievable work. You are absolutely the envy of the nation, but we've still lost 153 people. Please keep them in your thoughts and prayers. We don't ever want them to become that statistic that I talk about, no matter how many. We don't need them to become a statistic. They are a family. They are a person that was a great West Virginian, and now they are missed by a family and family loved ones and friends. Don't let them become a statistic. And just keep them in your thoughts and prayers. And absolute West Virginia, you got to keep doing it, because we're going to get there. This is a rough road. And we're dealing with something that's tough stuff. But we're going to get there, West Virginia. Thank you a bunch.
All right, thank you, Governor. Let's first go to Bill Crouch, Secretary of the West Virginia DHHR, and Dr. Ayn Amjad, our State Health Officer.
Okay, good afternoon. Yesterday, we received the first report of a probable COVID-19 death, which is going to be reflected in our dashboard today. This is consistent with how the CDC does report deaths due to COVID-19. The probable death is a person who does not have a positive COVID-19 on the laboratory results, but their cause of death is listed on their death certificate. So that will be a change on the dashboard that is going to be seen today online. Moving forward, these deaths will be reported as a probable death, and it's going to be seen on the dashboard. These probable cases is also going to be defined on the dashboard if anyone has any further questions. Speaking of probable cases, starting tomorrow in the daily media update that is released every day at 10 a.m., we will now combine these probable and confirmed cases into one total. This is how other states are reporting their data, so we'll be more consistent for people to follow. But if you want to see a breakdown of the confirmed and probable cases, those will also be broken down in our dashboard, so that will also be easier to follow. That is something new that you'll be seeing online on our dashboard today. We wanted to make that aware.
All right, thank you both. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Good afternoon. The governor has communicated, I think, very clearly one of the things that we all should be very, very cognizant of during this pandemic, and that is that the majority of deaths that are seen both in the United States and around the world come from people in congregate settings who are older, who have other pre-existing conditions. So nursing homes are really a central focus of many countries' death statistics. And so as we look at the spread of COVID from communities back into these congregate settings, it should give us all pause and should also refortify our focus in not only trying to test, but also to try to create mitigation measures that reduce the spread further. And so I think that the idea now, as we're into this more precise approach with COVID-19, of trying to identify and understand at a county level what is the community spread and what's the activity, as a way for us to make decisions not only about nursing home visitation, which is incredibly important right now, but also as we think about school openings and if schools and when schools are open, we think about school closings. Those same sort of metrics will hopefully start to inform the governor and other local and state officials about how we might want to navigate that. So we are actively working on that thresholding sort of approach. And the one that we've adopted in part is what you can find at the Harvard School of Global Health, which is an incident rate per 100,000 people. And so as we go through that, it allows us to compare counties on a more population adjusted basis, which will be important. The other couple of things that I wanted to touch on were, as the governor said, our RT value is improving, and that's really good news. And as we've said before, it usually takes a couple of weeks to see a reduction in the number of positive cases, and then perhaps another week or two after that to see a reduction in hospitalizations, as we've seen our hospitalizations go up a bit as well. But what we're seeing in the country, as we're seeing here in West Virginia, as parts of our country are starting to suffer more rapid infection and spread of COVID-19, like our rural states, you know, as West Virginia, as our rural counties, more rural counties now see higher incidence of COVID-19. So do states like Mississippi and Alabama and Kentucky and others. And so we see a more vulnerable population. So what we're seeing around the country is the number of cases on average is starting to come down a little bit, has reduced from 60,000 or over now to about 55,000 on a daily basis. But our deaths have stayed up. So the deaths that we're seeing from COVID-19 are still averaging over 1,000 over the last 7 days, which probably represents a more vulnerable part of our population that are now being infected. And I believe we're also seeing that in West Virginia. So it's really important for us to mitigate aggressively and try to do everything we can to suppress the spread in the counties with the most vulnerable people living in it. The last thing I will say is there was a study that came out yesterday or a couple of days ago that was published in the Boston Globe as a story on it that basically used a very simple laser technology to look at the function of masks and gaiters, the things you pull up around your face, and reported that gaiters were much less effective than 3-ply masks. Gaiters are usually one layer of material. And so that was given some concern because a lot of people use those. And this study said that the gaiters might actually make things worse because they may take larger droplets, make them smaller droplets, which could spread COVID even more rapidly. We have just finished doing a test in our inhalational toxicology laboratory with at least one type of gaiter mask, and that gaiter mask did not increase any risk to people wearing it, was better than nothing alone on your face, but probably, and we'll test this, probably less good than the 3-ply masks that people are wearing. So we would encourage people to wear masks if you have that option, but gaiters are still better than nothing. But that combined with physical distancing is very important in continuing to reduce the spread of COVID-19, as the governor has pointed out that people in West Virginia, you have done such a good job of so far. So thank you.
All right, thank you, Dr. Marsh. Next to Scott Adkins, the Acting Commissioner of Workforce, West Virginia.
Good afternoon. Thanks, Jordan. I just wanted to touch base a little bit on the presidential memorandum that President Trump signed on August the 8th, granting extended unemployment benefits for folks who are eligible. And there's the way it works. The federal government's going to provide through FEMA $300, and the states have to match at least $100 in order to qualify for the $300. Now, under the executive order, the states have the option. They have two options. One option is to provide $100 either in state funds or in CARES Act to match the $300, or they can use the current weekly benefit amount in unemployment to match that. West Virginia, under Governor Justice, has decided to provide the extra $100. And so when we were looking at, what's it going to cost, and we're thinking about budgets, and, anytime you plan a budget, you got to think about worst case scenarios. And so what we did, we took a look at all the different claims that Workforce has received since March the 16th. And we've taken about 119,000 PUA claims, almost 9,000 PEUC claims, 1,200 extended benefit claims, and nearly 250,000 regular UI claims. So that leaves us at 375,000 claims. We assumed that about 70% of those claims are compensatory. And so if you took 70% of the 375,000, that gives you about 262,000 potential worst case scenario claimants qualifying for the extra $400. West Virginia's share then would be about $26 million. And so when Governor Justice and I spoke about the $26 million earlier in the week, we were talking about worst case scenario for the state of West Virginia. To put that in perspective, right now, this week, the $100 share for West Virginia would be somewhere between $10 and $12 million. But again, when you're thinking about those budgets, you have to plan for worst case scenarios, because if not, if the economy tanks or Governor Justice has to make more shutdowns as we get closer to the end of the year, then we have to be in a position financially to be able to cover those worst case scenarios. And so that's how we got to the $26 million. The extra benefit should be coming soon. We've been on calls, been on meetings with the other states, with FEMA, with USDOL, and we anticipate being in a position by the end of the month to make that $400 benefit available to claimants who are eligible. There is one caveat. In order to qualify for the $400, you have to also be eligible for $100 in any unemployment benefit, whether it's unemployment compensation for federal employees, unemployment compensation for ex-service members, pandemic emergency unemployment compensation or PEUC, pandemic unemployment assistance or PUA, extended benefits that were in EB, or trade adjustment allowance. So if you don't qualify for at least $100 in one of those programs, then you're not going to be eligible for the extra $400. But keep watching Governor Justice's press conference, look at Workforce's website. Hopefully by the end of the month, we'll be in a position to offer those extended benefits. Thanks.
All right, thank you, Scott. Major General Hoyer with the West Virginia National Guard and Betsy Jividen, Commissioner of the West Virginia Division of Corrections and Rehabilitation, are also joining us today and are available for questions. Our first question today is from Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, if like you said, the spread of COVID-19 in nursing homes is largely being brought in by staff members, what, if any, steps are you considering to limit that, such as the mandatory quarantine for traveling out of state? It doesn't sound like restricting visitation is going to be enough to stop this spread.
Charles, it's probably not going to be enough to stop the spread, and I'd like our DHHR to comment on this. They're working on additional parameters and additional things that we can do, and maybe they can discuss that better than I.
Yes, Governor, thank you. This is Bill Crouch. That's a perfectly timed question, Charles. It's a concern. We know that, as I stated last week in the press briefing on Friday, we know individuals who are part of the community, whether they work in healthcare or work at a grocery store, et cetera, are bringing this disease back to West Virginia after traveling out of state. So we had a conversation a little earlier with regard to trying to get some educational efforts out to folks, not only in nursing homes, but in hospitals, where we're seeing more and more staff turn positive with this disease. So we're working on that, and we think it's important, and we think it's timely. So, Ayn, do you want to add to that any?
Sure, Charles. So besides travel being a spread, and the question comes up about asking people to quarantine at home, a lot of that is education. So we've asked people to take that upon themselves, be responsible if you go out of state to get yourself tested. If you're not feeling well, if you think you have a sinus infection, to stay home, call your family doctor. But along with that, if you've tested positive and if you're staying home, you need to stay also isolated from your family members at home. Wear your mask at home, stay in one room of your home, use one bathroom if possible, wash your hands properly, because we're seeing a lot of family spread in these counties. One person is positive, they're spreading it into their family members. That's causing the numbers to rise in those counties as well. So a lot of education needs to go into these. We're seeing in also facilities where people are taking smoke breaks together. They're not socially distancing themselves. So there's a lot of mitigating factors that we can take into account, which is a lot of educational factors. And those are the things that we're looking into, Charles, right now to hopefully help these counties reduce their numbers and reduce the spread. So it's not just the traveling that we're going to look into.
Yeah, Charles, let me add one thing. The closing nursing homes to visitation is a difficult thing for the families, and we made that recommendation to the governor by looking at the number of outbreaks we have that are fairly extensive outbreaks. We for months now have had outbreaks that have been 1 and 2 cases. We now have 4, moving to 5. Possibly 6 long-term care facilities that have a significant number of staff who are positive. So we're seeing double-digit outbreaks in staff and patients, and that's the reason we made the recommendation of the governor to halt or put a pause on that. But as the governor said, we're going to move very quickly. I never feel like we move quick enough in government, and we've had issues related to development of the alert system. OFLAC developed a system that allowed nursing homes to begin to gauge whether or not they could open or not. We never did define substantial community spread as a part of that. Of course, nursing homes had the ability, and many have gone ahead and closed visitation on their own based upon the amount of disease in the community. So we're looking at that alert system as well as the school alert system and the definition of substantial community spread, and trying to make sure all of those things are consistent with one another as we move forward. But we should have something out on all of those relatively soon. Thank you for the question.
All right, thank you, Charles. Next, we'll go to Taylor Stuck with the Herald-Dispatch.
Hi, everyone. It's Taylor with the Herald-Dispatch. I was wondering, as college students start coming back to campuses across the state, not just Mon County, Are we looking at maybe how we can prevent students from going to bars where they're not shut down, or will we need to shut down bars? How can universities try and make sure students aren't gathering even off campus to try and prevent this spread?
Well, Taylor, first and foremost, the schools are going to have to really step up here and encourage and educate and everything in every way. But in addition to that, you know, all the businesses are going to have to follow all the guidelines, follow all the protocols. You know, from the standpoint, you know, if you were going in a bar, that would be fine and dandy and everything to do, but wear a mask. I mean, wear a mask unless you're drinking. I mean, and absolutely, there's protocol to how we should social distance, and we should be, you know, on every other bar stool or whatever. We shouldn't be congregating up beside the bar. There's so many different things that we're going to have to do to monitor ourselves from a business standpoint, to monitor ourselves and encourage and educate ourselves from the school standpoint. But absolutely, Taylor, anytime and every time that any of us go do anything, there's some level of risk. When we go outside, you know, whether it be a Little League game or wherever we go, there's some level of risk. When we contact 3 people, there's more risk and everything. When we contact 50 people, there's more risk, and we've got to be more on guard. And we've got to absolutely just know that common sense prevails. Protect yourself, and you'll protect your neighbor. So absolutely, it's just a whole litany of things, but that's what it's got to be.
All right, thank you, Taylor. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hello, Governor and panel. This is Kenny Bass with Channel 8 and Fox 11. Governor, after watching what happened yesterday with the Big Ten and the Pac-12, and then to add to the confusion, the Big 12 has now apparently decided, I believe, to have football this fall as opposed to those other 2 conferences closing things down. What do you do with all that information and the advice that those people got from medical experts when folding it into the equation of West Virginia high school sports? And did you have your conversation yesterday with the SSAC? What was the result of that conversation? And are we any closer to making a decision about football in the fall for West Virginia high schools? Thank you.
Kenny, you know, we have had conversations nonstop with all kinds of different people. We've been texting, you know, back and forth and everything, you know, from a conversation directly with the SSAC. You know, I did not have a conversation directly with the SSAC yesterday. We had conversation through text, you know, but the reason I didn't do that is because simply just this, you know, because I still believe that from the standpoint of us being able to have sports, I know how important sports are to our kids and to our communities. You know, Kenny, just to tell it like it is, we've got a lot of kids that are so at risk that without sports, we're going to lose them. You know, I want us to be able to play. And from the standpoint of being able to play, we may end up playing with no fans. We may end up playing with only family. You know, we may end up not being able to play. We absolutely will not be able to play if in a county we're blazing red and everything, and the county's on complete virtual, and from the standpoint of learning and everything is shut down. But we're going to continue to just do exactly this. We're going to have our medical team and education team come out with a recommendation and a guidance on a scale of how the counties are working. From the standpoint of continuing on with the hope of being able to go back to school and with the hope of being able to have sports, I think we should go full steam ahead with the hope, with the idea of still being able to pivot, still being able to watch the numbers and pivot. Now, from the standpoint of WVU deciding, you know, that they're going to continue to play, or the Pac-12 continue to play and everything, I really believe that there's lots and lots and lots of things that are going into these decisions with bukus of medical experts and everything, and they're working on it in every way. And I believe with all in me, very confidently, that if you look at a Pac-12, maybe not necessarily the Big Ten, but really and truly, if you look at the regions of our country that this can some way develop into a political play, you've got to add that input into the whole equation as well. But West Virginia, as a great member of the Big 12 and everything, and what they're going to decide to do and everything, I'm sure is with real guidance and everything, and I'm sure that everyone still stands on ready to pivot and say, we can't do it. But it's just like with the basketball. When the first thing fell, what did we do with the basketball? We absolutely shut down right now. It's what I did with the state basketball tournament. We shut it down, and everything. And it may very well be that we end up doing that too. But I respect completely their decision, and I'm very hopeful that we're going to be able to play football. And I hope to goodness that it's going to be safe, and pray in every way that we're going to get through this. But that's just what we're going to have to do.
All right, thank you, Kenny. Next, we'll go to Larissa Casillas with Nexstar Media.
Hi, everyone. My question is about the probable deaths. How can someone's death certificate read that it was related to COVID-19, yet their test comes up negative?
That's for someone other than me.
Yeah. Okay, I can answer you, Larissa. So a person can be in an environment with someone who maybe has COVID-19 in a household. So basically their lab result will be negative for COVID-19. They can have the nose swab test or any of the tests for COVID-19, but the lab test is negative. So the person, maybe their family member has COVID-19, or maybe they were in the nursing home and there's COVID-19 in the area, but that's when the death report was filled out or the epi data was collected, but the lab result is negative. And then the person who filled out the death certificate wrote COVID-19 on it. So it's probable association with COVID-19 is where you get that. And it is a CDC definition for that, where it's coming from. So that is used across the country. But so they could have come from a home, personal home or a nursing home type facility, but that's where the word probable comes in, but it is CDC defined.
All right, thank you, Larissa. Next, we'll go to Dave Mistich with West Virginia Public Broadcasting.
Thank you, Dave Mistich, West Virginia Public Broadcasting. Governor, my question is about, this idea that WVU asked for bars to be closed. You're talking about local control when it comes to nursing homes, when it comes to, the reopening of schools. Why should, folks in Mon County have their local businesses and way of life dictated by the university when other governments on the local level will be controlling the way things work?
Well, Dave, I'll promise you this, that West Virginia University's input is respected and important, but it's not all the input by any stretch of the imagination. Just think about this for a second, Dave. We've just reported 12 deaths in West Virginia. The last day I was here, we reported 17 deaths in West Virginia. From the standpoint of we have talked to these businesses and everything, and they're submitting their protocol to us. The young people are just getting back on campus and everything. Now, from my standpoint and my standpoint alone, let's take everybody out of the equation. Take the county commission, take the Western University, take everybody out of the equation. Somebody's got to make a decision. And from my standpoint, we're waiting on the protocol, first and foremost, from these businesses. We want these businesses to be open. We want them to be open so badly, it's unbelievable, because I want us back to normalcy as quickly as we possibly can in every way we can possibly do it. Now, from the standpoint of the medical experts, our medical team, they said we need to get the protocol and we need a few more days. That's why I did 7 more days. This is not listening to anybody. It's not listening to somebody too much. This decision lies with your governor. We've just lost 17 and 12 more people. We have a situation here. We got the situation under control somewhat in Mon County by going to mandatory masks and closing the bars. We do not need another flood of a problem with all those kids coming back until we've got protocols and until we've got things in place. I made the decision. We got 7 more days. And at the end of the 7 days, I hope like crazy we'll be able to go back to work there.
All right, thank you, Dave. Next, we'll go to Annie Moore with WVVA.
Good afternoon, Governor. With some other states seeing a shortage, how is West Virginia's supply of testing kits looking long term?
Maybe General Hoyer, that'd be great for you, sir.
Yes, ma'am. We have test kits available that we have in as part of our stockpile supply to make available to certain entities that do testing for us, to include the state lab, West Virginia University, some other entities. We also are not seeing a significant shortage among the DHHR registered labs that are what are referred to as the reference labs. And we are moving along in good order with the new test development that we're doing through West Virginia University that will allow us to produce our own swabs as well as the transport tubes and what's called the VTM, which is the viral transport medium for those. So right now we feel that we are in a good place as far as West Virginia goes from that standpoint because of some direction the governor gave us early on to move out with different initiatives to be prepared for that event.
All right, thank you, Annie. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Governor, I see where the Greenbrier will be hosting a presidential fundraising event this weekend, and was curious how what steps will be taken to comply with COVID-19 protocols, including limiting group sizes to 25.
Phil, there's an awful lot, it's been reported it was a fundraiser for me. It's not a fundraiser for me at all. It's a fundraiser for the president and the vice president, and they're handling that through a lot of different ways. I think they're going to do a little press conference or whatever like that, and do some stuff in regard to the COVID thing. I think the numbers that they're going to target that are going to be there are not very many people. This is not a fundraiser where you've got 400 or 500 people there and everything. It's nothing like that whatsoever and everything. And so from the standpoint of the Greenbrier handling it and everything, I have no idea. I have no contact with those people at the Greenbrier from the standpoint of how they're handling this at all. But this is not a fundraiser for me, and it is an absolute fundraiser for our president and our vice president. And I'll be there and greet our vice president as I always would try to do. But from the standpoint of how the Greenbrier's handling it or the size of the crowd and everything, there will be no crowd, and I'm sure the Greenbrier will handle it very well. That's one thing that the Greenbrier has really done, and I'm really proud of seeing it on TV and everything. We just had World Team Tennis there. It was done exactly the way it ought to be done, and I didn't attend any of the matches or anything like that, but I watched it on TV. It's just more good exposure for West Virginia, and I think the Greenbrier's on top of what they're doing.
All right, thank you, Phil. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. Question about contact tracing. How deep do those interviews go? I know you want to find out where they've been and who they've been in contact with, but do you ask them if they have been wearing masks Do you ask what kind of activities they have been involved in? Probably a question for the doctors on the panel.
Absolutely, but I think Secretary Crouch and Dr. Amjad could start with it.
Yes, sir, Governor. This is Bill. Thank you, Paul, for the question. We've actually been talking about trying to do a short video to provide folks a little more information on how that's done, because it is fascinating. The training for that has been going well. We have, as I've said before, a number of individuals in DHHR who have gone through the training and are prepared and are doing some of the contact tracing. I don't have those numbers in front of me, but I'd like to get those for you Friday or Monday to talk about how many individuals are contacted upon a single case as a part of the investigation. I believe it's somewhere around 10. They look 2 days prior to the date that the test was taken, that the test was, the sample was drawn, so that we look at who those individuals were that were close to that person. And then that just spreads out in terms of those contacts with regard to any individuals, especially in the household, that might need testing, individuals who might need to quarantine, individuals who might need to isolate. So it is a very methodical process that epidemiologists are very attuned to in terms of spread and how that might happen. So we'll get some more information on that. It's an excellent question, and one that we've actually talked about trying to provide more information on to you, to the press, and to the public. So thank you for that.
All right, thank you, Paul. We have time for one more. It'll go to David Beard with the Dominion Post.
Hi. I hate to harp on the Mon County bar closure, but I want to address what appears to be a possible conflict of information, just to get it clarified. I think the governor said that the Mon Commission didn't have any real opinion on this, but that doesn't conform with what we were told, and I'll just read this from my email. According to this, the Mon commissioners told Bray Carey, with the proper safety precautions in place, we would prefer that businesses be open with proper safety precautions. In other words, it's not going to be a free-for-all. So basically, they conveyed to Bray Carey they wanted the bars open with proper protocols in place, and I wanted to get that clarified.
Well, David, I instructed Bray Carey to call the Mon County Commission and everything to just get them to weigh in, because, we had some surely conflicting, information and everything there. I sure don't want to, suggest or start a food fight there in any way, but the bottom line is they said, basically they wouldn't have any objection. I'm trying to get it right. They would not have any objection to starting back, but if things got bad again, they'd want us to shut it right back down. And my interpretation of that is, you're looking for, I mean, good gracious, that's what we all want in life, don't we? We want to say, well, we don't really have an opinion, but if things are real bad, you shut it down, Governor. Well, I mean, it's just that. I mean, really and truly, we need inside information, and we call counties to be able to have inside information. And we have counties, we expect and we want counties to weigh in and make decisions. These decisions are tough. That's all there is to it. I mean, it isn't helping any of us to just say, well, we're just fine and dandy if you want to shut it down, but if they or open them up. But if at the same time, if things get bad, we got to shut it down. Well, we know that. I mean, for crying out loud, anybody knows that. What we got to know is just this. I mean, all the factors that you'd weigh in, the kids coming back, do we have the protocols? Are we set up to really do it? We need inside information. Anybody can say, well, I don't really care what you do. You can shut it down, or open it back up. But if things get real bad, we'd recommend you shut it down. Well, that's not an answer. And Dave, in this situation, I was there. I asked Bray to call him. He was 10 feet away from me on the phone on one call, we were on other calls in regard to the nursing homes and all that kind of stuff. I was there. And that's the response we got. We got the response just that, which was not a response. It's a nothing burger response. I mean, we've got to have, real opinions and, in making these decisions. And we got to have inside baseball information. We got to have information right from the counties because we want to protect everybody in the county. That's what we want to do. We want to protect, and I'm sure the county commission and everybody does too. But you've got an influx of students that's coming like crazy. You got protocols that are in the wings we're waiting on. We got the university saying, weighing in and saying, this is our opinion. We asked for opinions from the county commission, and the opinion from the county commission said, we're okay with starting them, but you got to watch it, and if things get bad, we want you to shut it down. Well, that's not an opinion.
All right, thank you, David. Governor, I'll turn it back to you.
Well, I'll just add just this. I want to add one more thing in regard to county commissions or locals or whatever it may be. We're in this together. Everybody's got to have some level of skin in the game. It's easy. It's easy for people to sit back and say, well, we don't really care one way or the other, but it's not right. Everybody's got to step up and pull this rope together. And that's what we want to do. I mean, if in fact, that we just don't have opinions, then the likelihood that Charleston can make every decision and make the right decisions, not very good. That's why we have to have so much local input and everything, and that's what I call inside baseball information. We have got to have our local leaders be willing to make recommendations just as WVU did. It wasn't probably very popular for people, but WVU said, in our opinion, we don't think we ought to open. From the standpoint of the counties didn't do that. This came very watered down, and what we have got to have is we've got to have just everybody with skin in the game. This is really tough stuff, and we got to have everybody just make decisions as best we possibly can. We're not going to make the right decisions all the time, but we just want to make sure that we get the best information from all the different areas across our state as we possibly can, so we can make the best decisions we can. I really and truly don't have a whole lot more to report other than just the fact that we have lost 29 people in the last few days. And that's a big slug of West Virginians. And so at the same time, I want us to realize that Jim Justice wants your businesses open. Jim Justice wants your kids back in school. And Jim Justice is trying to get there as hard as he can. Now, he needs people to supply information. And when we don't get information, then we have to make decisions. And in this situation right here with the bars, we made a decision to wait on the protocols that's coming to us from different people and weigh in on the information that we had. And the information we had was WVU saying that they thought no for right now. I am trying so hard to get the bars, all the businesses back into motion and back into work. But at the same time, I'm trying more than anything to protect every single person in Mon County and every single person across this state. So I wouldn't ever sit back, because most people say, oh, I'm doing the best I can do and everything. Well, yeah, that's good. But at the same time, we've got to accomplish. That gets back to what my dad said, don't confuse effort with accomplishment. There's a lot of effort going on. I recognize it. I thank people for effort, but I want accomplishment too. And so I want us to accomplish in Mon County in every way. I love the county commission. I want to work with them. I need information from them, and we'll keep reaching out and trying to get information as we go forward and trying to make the best decisions we can make. Thank you.